Don't get the in-between finger thing.
Today we're doing a Tailor's bunion resection or repair, which is causing pain on the lateral side of the foot. Alright, so here we are in the operating room. We're getting the foot prepped for surgery. At this point in time, I'm giving a regional or local nerve block to the foot to provide anesthesia so the foot is numb during the procedure. You can see that there's a black cuff around the ankle. That's to provide hemostasis, meaning to prevent blood from entering the surgical field. We are now making our initial incision through the epidermis and dermis to allow it to have exposure of the fifth metatarsal head. At this point in time, the skin is retracted to allow visualization of the neurovascular structures, meaning the nerves and vessels.
Oh, you said which one?
Yeah, for the thing.
Oh, well, one right now would be good for now. I said the right now and you gave me the other.
We are now making our incision over the periosteum and the capsule of the fifth metatarsal phalangeal joint. This allows exposure of the fifth metatarsal bone. Once we free all the tissue from the fifth metatarsal head, allowing exposure of the bone, which we can see here, we are now going to resect the lateral aspect of the fifth metatarsal head.
Are you guys send specimen?
No. Ready to go?
Using a sagittal saw, we are now going to resect the fifth metatarsal head, which is the offending part of the bone. Now we are removing the lateral aspect of the fifth metatarsal head from the surgical field.
I'm fine, so it's almost done.
Now we're just taking the bone out. There it is.
Once the fifth metatarsal lateral aspect of the head is removed, we can see that the painful prominence is removed and the pain will be alleviated.
So once it closes up, it'll look like that.
Now we are just smoothing down the rough edges of the bone to prevent any rough margins.
Irrigation.
We will now irrigate the foot.
How come there's no blood?
Tourniquet.
Ah,
We do a bloodless surgery because the tourniquet. That's why we exsanguinate the foot at the beginning. Sorry.
I see.
Once this is completed, the surgical site is closed from the periosteum to the subcutaneous tissue to the skin using suture.
You can see that the bone is gone as well.
You can see here that the wound is completely closed. And after that, we will inject Marcaine, which is an anesthetic for long-term pain relief for about 8 hours. And the surgical foot is dressed sterilely with a dressing, and the tourniquet is released.
What?